Hi, and welcome to another episode of the Rotator Cuff Expert. I'm Dan Orcutt, orthopedic surgeon, and this is our third part of a series that we're going to go through what happens when the rotator cuff doesn't heal. So when we have a failed rotator cuff repair, what do we do next? And so the first video we talked about, we can repair or revise the rotator cuff repair. And there's different techniques that we can use to revise the rotator cuff repair and hope that it heals that way. The other option is to do a reverse. Reverse meaning we do a reverse total shoulder. The reverse total shoulder replicates the rotator cuff in some ways, and therefore we can do a reverse and have pretty good results. There's some limitations and some pluses and minuses in the reverse, and so take a look at that video if you want to know about the reverse. And lastly, today we're going to talk about reconstruct. So reconstruct means a superior capsular reconstruction. So what does that mean is that we, instead of being able to repair the rotator cuff, we reconstruct sort of the rotator cuff with a graft. So this is the evidence of the reconstruct. So you have the socket, you have the ball, you have the rotator cuff here that's failed, and we can't get it back here, or we can't reliably get it back here for it to heal. And so we reconstruct. We use a graft to go from the greater tuberosity, which is where the rotator cuff starts, and then it comes over and we will attach it to the glenoid, which is the socket. And so that's not really where the rotator cuff is. The rotator cuff is up here, and it comes down and it actually attaches to the scapula or the shoulder blade. And so we're not going to reattach this to the shoulder blade. We're going to attach this to the glenoid, and therefore we have this reconstruction. And we will often repair the residual rotator cuff back onto the graft. And again, there's a second picture that you'll see that you'll be able to understand, and maybe a better representation than what I'm giving you here. But essentially, we reconstruct the superior aspect of the rotator cuff. We do that as a force couple. So a force couple means we are actually trying to pull this ball into the socket and recreate what the rotator cuff does, allows us to elevate the arm, right? So if we don't have a rotator cuff, when we try to elevate the arm, it does to here, because that's as far as it gets. If we have a rotator cuff that's functioning, then we can rotate up and out and abduct. And so the attempt is for this reconstruction to allow the ball to kind of get squished into the socket, or force the coupling between the ball and the socket, and allow you to do at least some modified version of this. And so that's the purpose of the superior capsule reconstruction. And this is a picture that I made from, if you're looking top down, if this is the socket, right, and this is the ball, the graft goes from the socket here and is attached through anchors to the socket, and then it's attached over here to the greater tuberosity. What we'll do, typically we use a double row, which means we have a row of sutures here reattaching the graft, and then another row here to reattach the graft to give a better footprint coverage and hope that that graft is going to heal. So the graft can be multiple things. We can use donated tissue. So typically maybe what's called a fascia lata. The fascia lata is a type of graft coming from the outside of your hip. Obviously, that's not harvested or taken from the person that we're doing the reconstruction with, which will be from a cadaver donor tissue. Or we can use something called a acellular dermal graft. Some people use different ones. There's one out there, the brand is called Graft Jacket, which is the one that I use when we do the reconstruction. But there's multiple grafts out there that you can use. It has to be sturdy enough to be able to hold that the humeral head down, with the depressor of the humeral head, so they can get coupled into the socket so you can raise up. So you can do that arthroscopically or open, which means you can do through little poke holes and a little bit bigger poke hole to get the graft in. Technically, that's more difficult and more demanding, takes longer, but you don't have the incision. Or you can make a little slightly bigger incision, and we call this a mini open incision. That way we can have a little bit more ease in passing the graft into the joint and doing the reconstruction and doing the attachment to the graft to the glenoid and to the humeral, to the greater tuberosity. I don't think it really matters which one you do. Whatever you feel most comfortable with, and whatever you think you can do a really good job. Most of us would do a modified version, which we do both. We would both do a reconstruction arthroscopically, as well as maybe open it to put the graft on. And then lastly, rehab, right? Rehab is a little bit different. What we talked about last time is rehab after a reverse total shoulder is a little bit easier, a little bit less painful, a little bit faster because there's less restrictions because you have that metal and plastic, that hardware in there that's going to repair it, that's going to hold it together better, and we don't have to wait for things to heal. Now with the superior capsule reconstruction, we have to wait for the capsule reconstruction to heal, both here and here, and so that's slower. It's going to be slower. It's going to be more typical of a revised rotator cuff. It's going to be several months of rehab and protection before we let people go back to their normal activities. And it's important to understand that no one is going to get back to truly normal activities. There's nobody who's going to have a revised rotator cuff repair, with a few exceptions. If it was done poorly, then maybe. Typically, a large rotator cuff that's been revised because the tissue's bad, no one's going to get back to normal, forgetting that you ever had a shoulder problem with a revision of rotator cuff, with a reverse total shoulder, or with a superior capsule reconstruction. It's going to help. It's going to make things better. It's going to make things less painful, more function, more range of motion, more strength, but it's not going to be normal. So that's important to understand, excuse me, as you get into the process and talking to your surgeon. And that's the most important thing. Talk with your surgeon about what you think is the best. Is it best to revise it? Well, it depends on how good the quality of the rotator cuff is and how good of the repair was to begin with. Is it better to do a reverse? Well, it depends on your age and your activity level and what restrictions we might have and how long this will last. Obviously, the reverse is irreversible, right? So you can't undo the reverse, whereas the revised rotator cuff, as well as the reconstruction. Well, if it doesn't work, then you still have another option. That another option probably is a reverse total shoulder. And then that's really it. I mean, there's not a lot of other options beyond those three, but it's important to know that there are options after a failed rotator cuff repair. So keep that in mind. Talk with your surgeon. Kind of get the idea, his opinion, her opinion of what might be best for you. And the images that you see in the corner of this video, that is from, I got to read this because I won't remember quite right. That is from Superior Capsule Reconstruction for Failed Rotator Cuff. It's in the book Advances in Shoulder Surgery, pages 173 to 183, and that's from Mihata, M-I-H-A-T-A, T. Mihata from 2016. So we want to make sure we give credit for that image that we use today. Anyway, thank you so much, and we'll see you next time for another episode of Rotator Cuff Expert. Have a good night. And then lastly, Eli, you have to splice that together. The Bluetooth came on.